really, it's a very quick procedure. And I think this is really a preamble to it coming into the community urologist clinics and its usability. Of course, we all want to know about efficacy. And this is, of course, the first in class, as you said, drug releasing system in the bladder. We've never had anything like this where we have a sustained releasing system. And the idea of putting gemcitabine in there, at first I was skeptical, thinking, well, all we know is the prior trials and with Isla Skinner running the SWOG trial with gemcitabine, really not very exciting results with 1 year results of 20% perhaps in the BCG unresponsive space. But this is very different, isn't it? So we had 82% complete response rates at any time. And what's important is nearly close to half the patients have had that sustained response at 1 year. And I'm sure you have patients now who are beyond the 2 year mark. I have a couple of patients who are beyond the 2 year mark and continue to do great. So that's really important to sustain the durability of response, and it's all there in the paper, of course, in tables. Now, this is not to say that this is the curative therapy for non-muscle invasive bladder cancer, but it is a major stride, right? We have still limited options in patients who don't respond to BCG. Unfortunately, more drugs and more trials are coming down the pipeline, so we're seeing more of this. But I see this as a major sort of progress, major addition to our armamentarium of management of non-muscle invasive bladder cancer, especially, like you said, because of its ease of use and its efficacy. But let's talk a little bit about side effects, because initially I was just blown away. The first few patients had, like you said, zero symptoms, but then, of course, as with everything, as you do a little more, we start to see those side effects. So most of the serious side effects were well below 10%, and very few patients had discontinued the trial or had the device removed early. What was your experience, and what do you think about these AEs?
Yeah, I think, one thing that everybody has to understand, maybe people that aren't as familiar with this disease space, is these patients, they all have symptoms. No matter what you do, they're a heavily pretreated population, and they're almost coming in with, frequency, urgency, dysuria. They don't have, great bladders, I would say, like, quote unquote, great bladders. They've been biopsied, they've had TURBTs, and they've had a lot of BCG. So, considering that patient population and that amount of pretreatment, I thought patients did really well. There was, I think, less than 5% of patients that discontinued
Yeah.
treatment due to AEs. So we're talking about 95% of patients that went through, like a, pretty long, over 2 years, almost 2 years of treatment. So, at least, every 3 weeks, that it's a lot of treatments if you really think about it. So people are tolerating this. I thought I'd be interested to hear what you think. I thought that the patients sort of had a little bit of a different side effect profile. I mean, they still did have like the urinary symptoms, but I thought maybe it was more like BCG, for example, their symptoms would be like right up like that day or the day after, and then their symptoms would slowly, gradually, resolve. But I thought this was more of like a slow, like nagging discomfort, annoyance. And as the days went on, maybe patients would experience more treatment. And so like as we got, more volume, we started sort of preparing patients for that, saying, look, like you may not feel anything for the first few days, but as time goes on, like here are some, if you have problems here, ditropan, pyridium, that kind of stuff, you may need that as like, on day 7, for example.
Right. No, that's a very important point. I think you're right. I think the notion is people think that the device itself causes irritation, and I can say that with great certainty it's not the device, it's the drug. The reason why I say that is because when you look in some of the bladders, there's absolutely no inflammatory response necessarily to the device itself. Like it's not sitting in one place like a stent does, causing bullous edema and irritation in that one area in the trigone. This thing is floating around with the urine. So it's really the medication. And gemcitabine is acidic. And in some patients, just like you have idiosyncratic reactions to any intravesical therapy, some patients have some irritation. And you're absolutely right. That was my experience as well, that those symptoms kind of increased as time went. I've started using bicarbonate, sodium bicarb, to alkalize the urine a little bit. I think it's helping, and certainly the anticholinergics help. So we treat patients symptomatically as it comes. We don't sort of have a routine that we put all patients on this, because some patients come in and out, and I mean, as if like nothing has happened to them. It's really interesting. And of course, we see that with other intravesical therapies as well. But I think everybody feels BCG towards the fifth and the sixth treatment.